When I came upon Methodist, it was abundantly clear that they do an awesome job of giving you a really good base with which to go forward in your practice.
Right up from day one, you get great autonomy with patient management, obviously with guidance from faculty and seniors alike.
It's kind of the perfect setup, I think, for training in family med. The hospital size is kind of like mid-size. I want to say it's about 400 plus beds, so you get really broad training.
Both the faculty and senior residents are awesome at basically supporting us and meeting us where we're at, and slowly but surely kind of giving us more and more responsibility. So by the time you hit kind of the end of your first year, second year, you look back at how far you've come.
And that being said, another huge pro of Methodist, I think, is the relationship between us as residents and the specialists in our hospital. We rotate with them, and it's kind of become the kind of thing where we all hang out in the doc's lounge and you can ask them questions anytime, and it's really cool to have that specialist group on hand.
We have a lot of specialists who are eager to teach, and it's a very collegial atmosphere. We can call them up and consult them. We can curbside them without fear or trepidation. We also have a huge diverse patient population here in Minnesota. We have a lot of Somali patients, we have a lot of Bosnian patients, other Eastern European patients, and it's a really diverse patient population.
You're on the edge of where rural patients come in, you're on the edge of where urban patients come in, and then you kind of have this suburban population as well, so it's this really cool mixture of people that you get to see.
When I came here for my interview day, that really stood out about Methodist was it's a great place to work. You come to work and you're happy about the people that you work with, the residents, the faculty. It's really kind of a family.
It is not the warmest place in the winter months, but it's really grown on me. People here are amazing. People are lovely. It really does feel like home to me now. I've lived in a lot of different places. I've found my home here. Our faculty are really supportive and supportive of our personal lives, our professional lives, and really helping to build our career and just there for us with regards to whatever it is we want to get out of residency apart from the typical mandatory training.
Minnesota's emphasis on family medicine is different than anything else I've ever seen. So if you're coming from out of state, this is an awesome place to train for family med. They really emphasize primary care as being the center of medicine, kind of the heart of things, which I love. We get to do everything. We get to talk to everybody. It's really cool.
It's a kind of a fun part of our program is the creek is right outside, and that's actually the name of our clinic is Creekside. So whether it be over the noon hour when we got a little time or clinic patient no-shows, to just go and kind of walk the boardwalk that's kind of right next to the creek is kind of a good time to unwind and kind of unpackage some of the experiences that always happen during residency.
It's been great to watch the journey in myself and being the intern, not being somewhat unsure of myself early on to now being a third year and being able to lead a service and essentially run an inpatient service and feeling comfortable and confident in that my next job, my next phase after residency here, I'm planning on including hospital medicine into my practice and feeling comfortable that I can manage that along with primary care.